This is video 2 in a series on my thoughts as an endometriosis specialized dietitian on various diets for endometriosis symptoms. And in today's video, we are talking about the low FODMAP diet. So FODMAP stands for fermentable oligosaccharides, disaccharides, monosaccharides, and polyols, which are a collection of fermentable sugars we find in various plant foods. This diet controls for high FODMAP foods, thus helping to reduce GI-related symptoms like bloating, distension, changes in stool, consistency, diarrhea, and constipation. In addition to that positive outcome I just mentioned, some of the other science-backed benefits of a low FODMAP diet include reduction in histamine, and a buildup of histamine can certainly make symptoms unpleasant, like itchy skin, itchy eyes, runny nose, congestion, body aches, low-grade fever, and it can certainly intensify uncomfortable PMS. The literature has also shown this diet to be favorable for anxiety, depression, and fatigue. And because it helps to reduce abdominal distension and bloating, it can be effective for reducing abdominal pain. Some of the science-backed cons of the low FODMAP diet is firstly, some of the changes in the large intestine microbiome are unfavorable. So it changes the bacterial composition of the gut in a way that's less protective for endometriosis symptoms and endometriosis progression. There's more and more research coming out on the connection between the gut microbiome and endometriosis symptoms, your autoimmune disease risk, and how aggressive endometriosis proliferates. So this is an area where we have a lot of control, and we want to be diversifying and maintaining the diversity of that microbiome as best as we can. The second big con, and this is a big one because a lot of us in the endometriosis space already have underlying tendencies towards disordered eating. So the con that I'm referring to here is that it can exacerbate underlying disordered eating. This next con is kind of related to the first one I mentioned, which is that it reduces the amount of bifidobacterium in the large intestine microbiome, which is a very protective bacteria. And the last con is that there are some pretty significant risks for nutritional deficiencies with the low FODMAP diet. I personally never use the low FODMAP diet in practice. When I need to control for fermentation, I use the biphasic diet. You can learn more about this diet and some of my thoughts on other maybe related diets or potentially helpful diets for endometriosis in my full-length YouTube video on this topic. Head over to the link in my bio and click on the link to subscribe to my YouTube channel, toggle down to find the video, and happy watching.